the actual issue of where the spend should go. And I'm sure many people have had the experience of being in a meeting where they complained, well, we only got 3% growth last year, and the director of finance for the local authority stands up and says, well, we had a 5% cut last year. So we've seen a massive shift to the NHS in public services, and that's at local level. People just have to understand that has happened. But we are looking, and this is the work I do with older people and Live Longer Better. We now know, and this is a very good Department of Health report called Good for You, Good for Us, Good for Everybody, wonderful title. 10% of all medication does no good. And 20% of hospital admissions have drug side effects for the over 65s in some part. So what we're looking at are, could we create the idea of a therapy budget? And this would mean that we could switch resources from useless and harmful drug spending. And because I work with older people, this would be employing people who promote activity, social, cognitive, physical, emotional benefits from activity. Now, then we need to think a little bit about children and to look at the idea of a children's well-being budget. So how could we shift resources? Because there's evidence of unmet need, but there's also evidence of overprescribing for asthma, for example. So starting to think of ways in which, probably at the level of the primary care network, resources could be shifted to some local service that would tackle some of these determinants.